Welcome, everyone. It's 2:30, and the Lieutenant Governor will be here in just a moment. While we wait for the Lieutenant Governor, I want to thank everyone for their time today. This call is jointly hosted by the Utah Association of Counties. Randy Grace is on as the CEO of UAC, and then I'm Cameron Deal, the Executive Director of the Utah League of Cities and Towns. This is our weekly call with the Lieutenant Governor to try to improve coordination, share best practices, get an update of what's happening at the state level, and answer questions that cities and counties have submitted through UAC and through the League. So everybody knows UAC and the League are trying to coordinate on those questions. So we're receiving similar questions from our members. And so Brandy and I were chatting earlier today about putting together some FAQ documents and other shared resources between the two organizations so we can get more info out to you in the days to come. I anticipate there will be a lot of questions around the CARES Act and what that means for cities and counties, and the League and UAC are both actively working on those pieces. So even if that does not come up on the call, stay tuned for future emails from the League and UAC on that topic. Brandy, anything you want to add before the Lieutenant Governor arrives?
Just so that our members know that we are paying attention to the messages that are coming in, both via text to staff members as well as the COVID-19@uacnet.org email address that we've set up. So we're watching for those, and we'll continue to follow up to make sure that the answers to your questions are being provided, and we'll summarize those. So both what's being asked here as well as the additional questions, some of them coming from the state level, some of them the federal level, as well as coordination amongst the counties. So we'll work to compile that information, make it easy for you to find. So continue to watch our website for those updates.
Perfect. And then you can look at the League website for our updates as well. And speaking of updates, we're honored to have Lieutenant Governor Spencer Cox join us. Lieutenant Governor, are you there?
I am, Cam. Can you hear me?
I can hear you and see you. And it's always nice to see you remotely, though I look forward to the day where we can all join each other in person and actually give high fives.
I hope that day is coming soon, sir. I agree. Thank you so much for taking time and for giving us this forum, this opportunity. I was just with the governor a few minutes ago. Unfortunately, he couldn't join us, but he asked me to convey his gratitude to all of you for the great work that you're doing as leaders in your communities at the local level. I want to give some updates, and then we'll take some time for questions over the next 25 minutes or however long we have left. Let me give you, I would love to start with some, we haven't had a lot of good news recently, but I think that there is an opportunity to share some good news right now. And that good news is that it appears that our efforts are starting to pay off. And I know that's been the question. Now, it's a short sample size, so we want cautious, and I know our state epidemiologist would tell me the same thing, to be cautious until we can see a continued trend. We won't know for sure, but the good news is, as of today, we have 887 positive test results, and that's an increase of 81 from yesterday. And we saw about 80 the day before. That is down the last 2 days from about 115 to 120 from the 2 days before. We were starting to see a rate of about 120 per day. So getting that down under 100 is a really big deal. That's a 10% daily increase today over yesterday. We had seen some daily increases in the high 20s that were very concerning to us. And so the data appears to show that the physical distancing measures that we are all taking are starting to pay off. Some other good news: our rate of positives over that day was 4.7%, which continues to be a trend of over the entire course. Our positive rates of tests have been about 5%, which is lower than many states and many of our surrounding states. So the fact that we're testing people who we mostly think have the disease, or at least have the symptoms of the disease, and have a 5% rate is better. We've seen rates as high as 30% in some states, so that's great news. We have 5 total deaths statewide. This latest one yesterday is from the Weber Morgan County Health District. I was a resident of a long-term care facility, which we always worry about. The good news is that the case was found early and all precautions were taken and to prevent spread. And there was testing done there in the long-term care facility. And the person's roommate and others was isolated and tested negative. So we don't anticipate any more spread from that case. I mentioned some of the good numbers. About 10% so far of the documented cases coming from community spread. Of course, that is higher in some counties than in others, but that's a good news. Most of the positive tests that we've seen so far have come from those who were in contact with someone who got it traveling. So we know it is spreading here in the state of Utah. The other really good news is that we have significantly increased our testing capacity over the past week. If you'll remember last week when we had this discussion, we were barely testing 500 a day. That increased over the course of the week, 500 in a minute. As the governor has mentioned many times over the past couple of days, the next 2 weeks are really, really critical for us. We're ramping up hospital capacity. We're freeing up beds, freeing up ICU beds, making sure that as we move towards that we don't overwhelm that system at all. And we're grateful for our hospital administration. I'll talk a little bit more about our crisis standards of care and the things that are happening there. But you may have seen that the president of the United States I believe it was on Sunday, it may have been Saturday, it kind of all runs together at this point. They urged us to continue. They sent out their basically reconfirming what they put out before that was supposed to end in 2 weeks now through the 1st of May. They're urging us to maintain the social distancing guidelines that we have put out and directives that we have put out. And so we're hoping to get ahead of that, obviously, and to be able to loosen those sooner. And I'm excited to share about how we're going to do that. There have been some changes that have been made that I want to bring to your attention today. Many of you know our state health department, Dr. Miner, Joe Miner, who is the executive director there. Some of you may know that I guess over a year ago, he had some significant health problems. And because of that, he's especially vulnerable to COVID-19. And so he's still on as the executive director, but we have brought on General Jefferson Burton, who many of you know, who was the adjutant general here in the state of Utah for some time, recently retired, has come back on to oversee the health department during this time. And he has a training from Harvard in crisis management. Again, run big organizations, really understands how to operationalize the things that we need to do on massive scale. And so his leadership is going to be extremely valuable to all of us in the state of Utah, and of course working with our local health departments as well. So I wanted to make you aware of that. Also wanted to talk a little bit about what's happening with our incident structures. So as we do in any emergency, as we did when we did when we had the earthquake here not long ago. Crazy that the earthquake seems like a distant memory and just a blip in what we've been going through. But we have stood up our incident command and brought the health department's incident command into the state's incident command. And Jess Anderson, who some of you know, is the director of public safety, commissioner of public safety for the state. He's overseeing that, and everybody is integrated into there. We have briefings every morning and every night, and everybody is reporting back, and the different task forces and working on getting medical supplies and making sure we have enough beds and increasing testing. All of those things are being shared every morning and every night. So we're excited about that development. This will really help us operationalize what we're doing. I mentioned the crisis standards of care. If you're not familiar with the crisis standards of care, may be of interest to you, but this is something that has been around in the state for many, many years. It's a document that was worked on by our health officials and many others. And the the good news is we've never had to use the crisis of standards of care. The unfortunate news is that we are preparing to do so in case we need to get there. And I should back up. The crisis standards of care really is to prevent us from getting to the to where we have to decide who gets treatment or what kind of treatment that people get by, first of all, bringing all of our healthcare systems together, all of our hospitals together, so they start operating as one unit in concert. And that's a really, really big deal. It helps us spread and allocate those resources out across the state, wherever we have hotspots, to make sure that we are giving everyone the best care possible at every level. And that we're spreading out those resources in a manageable way. At the end of the crisis standards of care, though, we get to the point where if we don't have enough beds, if we don't have enough ventilators, how we make those choices, and so that runs the hospital association. Those groups are meeting now to refine the crisis standards of care relative to this specific crisis. They're anticipated to cover just about anything. Of course, the big earthquake drills are the ones we're always kind of working on, but for it also covers pandemics, and working very closely on that. Now, I want to talk a little bit more about how we get out of this thing. And we understand that this physical distancing or social distancing is not something that we can do forever. Obviously, the impact to the economy is incredibly difficult for so many people, but also just the where that takes us on us as social beings. It's going to be difficult to do this for a significantly expanded period of time. And the good news is that there are better ways to do this. One of the reasons we haven't been able to get there is because, and this has been well documented, the lack of testing in our country. When the original tests were sent out, they failed, and so we were about a month behind of where we should have been. But if you look at the countries that have done this right, South Korea is probably the best example. Germany is doing this. Others are really following along. What we're working on is this idea of testing and tracing, and how important that is, because if we can't, we don't want everybody to have to be locked down until we get a vaccine for this. So what we have to do is we have to figure out who has the disease, and then we have to isolate them, and then find out the people they've been in contact with and see if they've contracted the disease, and then isolate them, which will allow those of us that don't, or those of us that have recovered, to go back to doing the things that we need to do, and of course continue with appropriate measures and washing our hands and all of those things that are so important. But we can only do that if we significantly increase the testing and tracing. That is why these next 2 weeks are so important. One, again, to stop the spread of this, make sure we don't overwhelm our hospitals, but also to help us stand up what we believe will be the most robust testing and tracing capacity anywhere in the country. There are a lot of obstacles to make that happen, but we have the very best and brightest working on this around the clock to be able to do that. So as I mentioned yesterday, we were able to test 2,500. We really need to be testing close to 7,000. That's where we want to get. So right now, we can test anyone who has symptoms, and we encourage you, if you do have symptoms, to please go get tested. That is helpful, and that's the first step. But we need to be able to test even more than that. We need to be doing randomized testing who don't have symptoms, because one of the things we know about this disease is that it appears that there are many people who are asymptomatic. Some people have the disease and may never know that they've had it. So the first piece is being able to test as many people as we possibly can, especially those who have it and those who've been in contact with those who have it. This is going to put an increased workload on our local health departments, who are their job is the tracing piece. When somebody tests positive, they work closely with them to go back and figure out who they've been in contact with, see who else has symptoms. And so we need a lot more people with that that can help with that. And we've been working very closely with our state employees. We're getting new employees. We hope to have 1,000 by the end of today who can help our local health departments, can get trained up very quickly in tracing, all this done from their homes, contacting and tracing, and ramping up to those 7,000 tests a day. Now, you may have heard some of the good news that the president announced yesterday. The Abbott Labs has come up a 15-minute test. That's the other piece of this. You have to test people and get the results back quickly. If they have to wait 7 days to get the results, they're going to infect other people. And we've got to get that infection rate below a one-to-one transmission, so that for every person infected, they're infecting less than one person. So we, to do that, the rapid testing is going to be important. So the good news is we have this new test. The good news is they're sending us out 15 machines that can run those tests in 15 minutes. The bad news is we're only getting 100 test kits. So that doesn't help us very much at all right now. Now, they do say over the coming weeks they'll be able to produce 50,000 tests a day, but that's just for the entire nation. We're just 1% of the entire nation. And so getting enough of those tests for the foreseeable future is going to be difficult. But we have other things that we're working on. Some of our friends at Silicon Slopes have been working with other labs. We've involved the private sector in the conversation from the very beginning. And they're working with us to ramp up testing and test sites, because we also need testing sites throughout Utah where we can do this more quickly. And so with their help over the next couple weeks, we'll be talking about more locations for testing and ways to get more people tested and get up to those at least 7,000 tests a day. Ultimately, we'd love to get up to 10,000 tests a day. And that's going to be a really big deal. Just a couple other things that we want you to know about. There's a new free seminar available through the University of Utah's Eccles School of Business, and that is going to be for businesses. It's called Navigating COVID-19: How to Save Your Business. And we'll send out we can send out the website to you guys for that. It's April 3rd from 11 a.m. to 1 p.m. Again, it's free, and people will be able to take that class remotely and help our businesses be able to stay on their feet. We also announced some a small business bridge loan program. I know the CARES Act, and I'll just tell you, we're working our way through the CARES Act right now, the federal act, helping us understand everything that we need to know and figuring out how we can actually get that out more quickly to all of us, so that the resources that are promised therein. That the federal government is notoriously not great at that kind of stuff, and so we're going to try to help them everywhere we can to do that. But these small business bridge loans for businesses of 50 or fewer employees that are eligible, they're 0% interest loans up to 60 months, from $5,000 to $20,000. This is our first tranche. We're hoping to get more resources to be able to expand this. We're working with the legislature on that. 25% of the funds are reserved for rural businesses. And we're repurposing other funds to make this happen. Application begins today, I believe, for the first round of loans. And you can go to coronavirus.utah.gov and click on the business section to get there, or go to GoEd's website for that. We also announced yesterday the start of our One Utah Child Care program. That is for our frontline people who are at the who are our doctors and nurses and first responders. You can go to jobs.utah.gov and register for free childcare. Currently available Monday through Friday from 7 a.m. to 6 p.m. And also they'll work with local providers for hours outside of that. These are for those of school-age kids, distance learning will be provided there as well. And so we're very excited about that. I think I've covered most of the things that we needed to talk about today. Just know that our first priority is health and economy. Those are the two things that we're focusing on. Excuse me. Let's see. I think that's it. So let's get to some questions.
Perfect. Well, thank you, Lieutenant Governor. And there was a lot to unwind there between the efforts with the new chain of command, the bridge loan program, the extended testing, and everything else, so that everyone on the call, just to remind you of the rules of how we've been managing the call. Brandy Grace has a list of questions from the Association of Counties. We have a list of questions from the League of Cities and Towns that we received in advance. We have shared that with the Lieutenant Governor and his staff. We'll be walking through those questions. As other questions come up on the chat room, if time permits, we'll get to those. If not, we'll collect all of them and bring them through the process individually over the next few days between now and next week's call and try to get them answered before next week's call. So with that being said, Lieutenant Governor, the first question revolves around just the overall issue of testing and information to the public. You referenced coronavirus.utah.gov. There's been a lot of discussion about the dashboard around testing and tracing. And so the mayor of Tokerville, Lynn Chamberlain, is asking, are there going to be other tools beyond coronavirus.utah.gov, like a dashboard to provide ongoing data around where you can get tests, how many people are being tested, how many people have recovered, how many people are sick, or is all that going to be funneled through coronavirus.utah.gov?
Yeah, great question. So hopefully, if you haven't been to the website for a while, I would encourage you to go back today because we've added more tools on the website today, more data and more information. And we will be adding to that over the coming days in a public-facing way. And so there's a breakdown now about the age groups that have tested positive, more location data, that kind of stuff. And so I would encourage you to go and look if you haven't had a chance today to see what we've added there. There will be more coming. One of the things that we've been talking about is the recovery piece and trying to track the number of people that have recovered so we can kind of see what's happening on the back end. So we're working through that data as well. Part of the trace. Oh, by the way, I think there's a piece on there today. At least it's supposed to be on the numbers that have been hospitalized. And so what we're working now to do is to get all of the information from all of the hospital systems. Most of them have been really good. We still have some that we haven't been able to get all the data that we need so that we can track the number of ICU beds that are available and the number of bed, just regular beds that are available, and we can follow that on a daily basis as well. So there are more data pieces coming on as we expand this contact tracing and testing piece as well. We'll be sharing more of that data with you over the next 2 weeks.
Terrific. Thank you, Lieutenant Governor. Brandy, your question.
Before I ask the first question that we have, just a point, Lieutenant Governor, we've had some requests from our community leaders that as you build that dashboard, if you could also focus a little bit on the recovery. There seems to be so much emphasis on the number of confirmed cases and deaths, but if we could also make sure that we're tracking the statistics of those that are in recovery as well. I think.
Yeah, no, and that's what I just said. That's exactly what we're talking about. Yeah.
Okay, good. The first question has to do with the existing statewide public health order that's in effect. I believe it expires tomorrow. There was a directive that came from the state, but as we understand it, it does not take the place of the statewide public health order. Of course, we appreciate the effort to allow local health officials to work directly with their communities on what works best for them based on current information. But will there be a new statewide public health order? And is there any opportunity for our members to maybe have just a little bit of heads up on what's to come so that they're prepared to respond to their business community?
Yeah, it's a great question, Brandy. Thank you. So there are no discussions right now about any changes or expanding. Now, obviously, those things are being reviewed every day, and so my anticipation. I don't want to speak out of turn here without the governor actually saying this, but that we will see the order extended to match the directive. But I'm not foreseeing any major changes to that order at all. So it's pretty much kind of business as usual. It's not as usual, but business as it's been the past 2 weeks. So we will absolutely give you a heads up if there are any major changes that you need to be aware of. But I am not aware of any of those right now. I will say there is one change that is coming down that I think will be helpful to you and to many of your members, though. The governor is over the next 30 days under the supervision of the Department of Agriculture. We're going to allow restaurants to repackage and raw and prepackaged foods in their inventories. And so that will, we think that that will be helpful as well, and supplies that they may have to get out to, that they can sell to the public. So that is just one thing I wanted to give you guys a heads up on. But other than that, I'm not aware of any major changes that are coming in the next few days.
Perfect. Thank you, Lieutenant Governor. My next question gets back to health data and the sharing of data between local health departments and cities in particular. And we've received questions from cities such as Saratoga Springs, Highland, Grantsville, and others around the state who have had some frustrations trying to get specific health data from local health departments. So is the state working on a broader data sharing policy? And before you answer that question, so everybody knows, our board of directors talked about this very issue yesterday with Jill Parker, who is the executive director of the Association of Local Health Districts, and brought this very concern up, and she was going to take it back to the health departments. But the concern specifically is that cities are sending first responders out in their communities, but the cities don't have the data of how many people in their cities have tested positive or have been tested. And so is the state task force working on a broader data sharing policy for local health departments and local governments?
Thanks for bringing that up, Cam. We have not had that specific discussion. In fact, I was going to. I didn't know if Jill was on here or not. But it's certainly something I'm willing to take back, and it sounds like you've talked to her already. But we're happy to have that discussion as well. I will say to our local health departments, and I think our counties probably have a little bit better understanding of this. And I just want to defend them a little bit. We have underfunded, our nation has underfunded public health for a long, long time. And I was, as a county commissioner, I had the opportunity to serve on the Central Utah Public Health Board, and was the chair of that board for a time back during the H1N1 spread. And it was amazing to me how much they do on such a little budget, and they are all understaffed and underfunded and have been for a long, long time. And it's one of those things where we don't think about them until we need them, and now we need them. And so I hope we'll be patient as they are overwhelmed. Like I said, we're trying to get them 1,000 new employees to help them with some of their other things, so that they can hopefully respond better to this portion of it. But we're absolutely happy to work with them and see if we can't get more localized data out to people. So that, historically, we've just dealt with, a measles outbreak in a school district or something like that. And this is definitely different than they're used to. And so we want to give them the support that they need so that they can be more responsive.
Terrific. Thank you very much. Brandy.
We all certainly hope that we don't see the influx in positive cases that we've heard and seen from in other states, but is there any coordination being done by the state to manage a potential surge in the various counties? For example, what if a hospital in a certain community is filled to capacity? Is there any coordination of where those patients would go at the state level?
Yeah, there is, Randy, and that's exactly what the this crisis standards of care group is working on. They have plans in place for that, but they actually met today, I think at noon, with their broader group, and that was one of the agenda items. Is how do we coordinate transport of individuals who are sick? Because so the way this works, obviously, people go to their local hospitals and we fill those beds. And what we never want to happen is to have empty beds in one part of the state and an overflow where people aren't getting treatment in another part of the state. And so the idea behind the crisis standards of care is that then we will work out the flow chart for how we transport people so that we fill up all the beds equally, all the ICU beds equally, and then we start going into our overflow capacity contingencies. And by the way, those are all being worked on. Sites for overflow have been found. The resources are being brought in to prepare for those sites. And again, our hope is we will never have to use them. And again, this is the good news. And Dr. Dunn talked about this in her presser today. If the rates that we've seen the last 2 days continue, we won't reach capacity. That's the best news we've heard in a long time. Now, that only continues if we do the hard things that we're doing right now with our physical distancing and making sure that we're being really smart and staying at home whenever we possibly can. But that, if that's the case, we will never reach that surge capacity. There is some, and I would encourage if you go out, the University of Washington did a model. Modeling is very, very difficult in this. But they did a model that showed that the state of Utah would likely be reaching our surge or our peak end of April. We've seen some kind of 1st of May. Depends on how well we do with the distancing, and the testing and tracing. But that showed that we probably wouldn't overflow our beds, but the ICU beds, our regular hospital beds, but ICU beds could be overfilled. And of course, ventilators and that piece that we're trying to get more and more of that. So what we're doing now is buying us time. Hopefully that never happens, but if it does happen, we're able to expand that bed capacity. So we'll be working especially with our rural hospitals and others where they don't have much capacity. I mean, some rural hospitals only have one ICU bed or no ICU beds, and those are the ones that we're going to have to be extremely careful with and make sure that we have policies in place to move people where they need to go. So looks like we have time for probably another question.
Can you do one question UAC, one question League?
Yep.
Okay, perfect. And the last question from the League, it comes from Ty Bailey, the Morgan City manager, but it's a question that we've heard repeatedly over the last few days. And that is, you have cities that are looking to provide relief to residents during this time in the form of not shutting off services like utilities during this crisis. The federal government in the CARES Act has contemplated providing direct assistance to residents to help them pay their bills, help businesses pay utilities and payroll. Is the state looking at any similar program? And then by extension, we know there's going to be a special session in April. Where's the dialogue right now around the implementation of the CARES Act and the local government components of the CARES Act, or is it still too early to tell right now?
Yeah, what I can say is we are having discussions about the CARES Act and what that's going to mean. It's a little premature to talk about. We don't have any hard and fast plans. We would appreciate input from your members as you have it, and to share that with us. I don't know that we'll see from the state side anything directly to the citizens for those types of expenses. Again, I think most of that we are looking again at the small business side, and let me just explain very quickly why that is so important. On the small business side, those bridge loans and keeping that open. We want to be able to ramp up the economy once we get out of this on the other side. We do have right now, and let's tell people to be patient because we're seeing record numbers of applications for unemployment insurance right now. But we do have unemployment for those that are furloughed. Okay. Here's some good news. Although we're seeing record unemployment filings, 95% of those are furloughed, which means that they have a company to go back to once we get on the other side of this. What we don't want to do is to lose those businesses, because if we lose those businesses, then there's nothing to come back to, and then the economy doesn't recover. And so we really want to do everything possible to keep the lights on at those businesses, so that employees do have a place to come back to when we get through this. So the idea working with our federal partners was that piece was going to be huge for helping our citizens, getting them some relief over the next couple months, so that they can pay their bills, and then we'll have jobs for them to come back to afterwards. So what I would say is stay tuned. We're working very closely with legislative leadership to see what will go into that special session. And if you have ideas, please send them our way.
We have, so everyone on the call knows, the League and UAC are working together on gathering data that would help inform the conversation about how to implement the CARES Act. So Lieutenant Governor, your wish is our command. You'll be getting plenty of input from us in the days to come. So Brandy, take it away.
Thank you. Final question, Lieutenant Governor. This has to do, I think, more with maybe messaging or our communication. We all heard in the governor's press conference where he talked about limiting non-essential travel, even to visit family on weekends. What we're seeing in our communities, and I've heard this from Washington County, where there's a concern that there's an influx in the number of people coming in from California. They're saying that you look in the parking lots of the parks and only about half of them are Utah license plates. There's people still coming in from out of state. So that's one piece of it. But in addition to that, people who are traveling from one community to another to get out, and they're kind of looking at this as a time to get out and enjoy the outdoors, but feeling like as long as they're maintaining that social distancing and being careful, that's within the parameters of the directive. Can you give us some clarification on that and what we should be messaging?
Sure. Yeah, I know this is a really difficult one for everybody. So there are a couple pieces of this that I think are important. Along with that directive, the governor did say that our state parks are closed to people from outside of the county. Now, it's hard to enforce, but the hope was that the messaging would help people to stay within their county. And so that is an important message. I will tell you, we are looking at our ports of entry and ways that we can, and it's hard to see. You don't want to stop that flow of traffic. Obviously, the flow of commerce is important. Getting goods to people is critical, but limiting the amount of infected people, because if we could do everything right here, and if we have a steady stream of infected people coming into our state, and we're losing ground. That's a concern. Also concerned, I have Commissioner Iverson saying that they don't want us to do anything down there and want people to still come, and others. And so we get mixed messages from people within your own groups. But I do think that is a message that we can hone and that we can get out and that we can emphasize. The governor is doing daily press briefing now, which allows us every day to have a new message from him. Today yesterday he focused on young people who think they can't get the virus. And if you look at the new data that we're putting up there, it shows that our highest infection rate is actually in the younger population, 20 to 35 or whatever those numbers are. And so it would be, I think we could do a message about travel, just specifically around travel, and encouraging people to not go down. I will say in some other states, we've seen, Idaho is a great example. Their highest infection rate right now is in the Sun Valley area, where they only have one ICU bed, and that's really because people from California and from Washington all went to their summer homes and then got people infected up in that area. So I do very much worry about southern Utah, especially because we have an aging population down there that trends a little older than the rest of the state, and are particularly vulnerable to the impacts of the coronavirus. And so I will bring that up to the governor to talk a little bit more about essential travel and avoiding travel that could put others at risk in those vulnerable communities.
Thank you.
All right. Thanks, everybody, for putting up with me. I'm sorry that you have to listen to me for all that time, but I'm grateful that we have this opportunity to continue to communicate. And if I could, I just want to really give a shout out and thank Cam and for what you guys are doing. You've just been incredible. I hope your members know that. You've been in every task force meeting. You've been bringing ideas to the table. You've been helping us work through some of these really difficult issues, and we could not do it without your local leadership. So thanks for all you're doing, and let's get through another week. March is finally over. I didn't know there were 57 days in March, but it sure felt like it. And hopefully April will have better news for us. So thanks, everyone.
Terrific. Thank you, Lieutenant Governor. We'll see you next week, and everybody watch for the nightly email with updates.
Thank you, Lieutenant Governor.